Hi there, my name is Maria Khalid. I am a second-year medical student at the University of Alberta, and my summer project was understanding mothers' decisions around use of donor human milk for supplementation. 90% of mothers in Canada start breastfeeding, but over 60% of full-term newborns need supplementation within the first few days of life. Typically, supplementation is done with formula, but its use can have very negative emotions and feelings, especially for mothers who plan to exclusively breastfeed. Donor human milk is an alternative to formula, and it comes from healthy scream mothers and it's pasteurized to ensure safety. Unlike formula, it's biologically similar to a mother's own milk, provides essential nutrients, antibodies, and bioactive components that promote healthy development. Preliminary study findings from a study found that mothers who were supplemented with donor human milk within the first few weeks of life were almost 7 times more likely to exclusively breastfeed at 3 months compared to mothers who use formula. And continued and exclusive breastfeeding is great because it provides lots of benefits for both mom and baby. Although formula does give the baby the essential calories, it can disrupt the infant gut microbiome, which is important in things like digestion, immunity, and long-term health outcomes. The purpose of the study was to understand why mothers who supplemented with donor human milk were 7 times more likely to exclusively breastfeed at 3 months compared to mothers who supplemented with formula. My hypothesis was that access to donor human milk during early postpartum supplementation would help mothers feel more confident and supported while they wait for their own milk to come in, making it easier for them to continue breastfeeding. And my intended outcome from my work was to inform hospital supplementation practices and guide policy development to expand access to donor human milk across Alberta. My study was a qualitative sub-study, which was based off original pilot trial that was conducted at a postpartum unit in Alberta, Canada. I had 20 semi-structured interviews. 10 moms were in the donor human milk group, 10 moms were in the formula group. And my interview explored maternal feeding goals, perceptions of supplementation, emotional responses, and overall experiences with feeding and lactations. The interviews take place over Zoom. They were audio recorded, transcribed verbatim, and were analyzed thematically using the software in vivo. Using an inductive approach, the transcripts were analyzed and 5 themes emerged from the data. The first theme was that donor human milk acted as a bridge to breastfeeding, allowing mothers both a practical and psychological support, which offered relief and reassurance while they waited for their own milk supply to come in. The second theme was that formula was viewed as McDonald's with baby food, and it was framed as a last resort. Although it was nutritionally sufficient, it was seen as synthetic or harsh on infants' tummies. The next theme was trust in donor human milk. Screening, perceived naturalness, and some mothers' prior experience as donors fostered confidence, and many equated donor human milk to their own milk and viewed it as superior to formula. The next theme was pressure and cultural expectations. Mothers reported strong family and cultural pressures to breastfeed, and donor human milk was able to alleviate this pressure, which allowed mothers to focus on recovery and milk production. And finally, mothers were unaware of the breastfeeding complexities. Things like triple feeding, mastitis, tongue tie, and fatigue highlighted the difficulty of exclusive breastfeeding, reinforcing the value of supplementation. In conclusion, donor human milk was seen as more nutritious, it was able to support maternal confidence, and it was able to extend the critical window for milk supply establishment. These insights suggest that expanding equitable access to donor human milk in postpartum units alongside robust family and provider support could enhance maternal satisfaction and breastfeeding success province-wide. This project addresses a significant gap by understanding how providing donor human milk as supplementation option affects maternal mental health, feelings of guilt, and breastfeeding continuation. Many mothers face emotional challenges when they need to use formula, such as feelings of failure or stigma. By offering an alternative that aligns more closely with their breastfeeding goals, donor human milk may alleviate some of these negative emotions. Through in-depth interviews with mothers who use donor human milk during a pilot project, my research was able to uncover personal and emotional insights that numbers alone cannot provide. These findings were able to highlight the human side of healthcare decisions, creating a fuller picture of how access to donor human milk impacts maternal experiences. Finally, this work has the potential to drive meaningful change. It could help healthcare providers, policymakers, and milk banks better understand how access to donor human milk improves maternal well-being and breastfeeding outcomes. My findings will also support the expansions of donor human milk programs, making this valuable resource more accessible and affordable to families. By exploring both maternal and infant outcomes, this research contributes to the broader understanding of early feeding decisions. Finally, these are all my references. Thank you so much.